Madeline Leininger is all focused on culture. Her model is all about cultural care and cultural understanding. And so she is like the preeminent or the most well-renowned nursing theorist about culture. There's other nursing cultural care models. David Heiser and Geiger is another very popular one, but Leininger is kind of considered like the gold standard of cultural care models. So in order to talk about a cultural care model, we should actually just look at culture for a couple of minutes and understand that culture is very complex, right? It's not easy to define, and everybody's culture is unique. So cultural encompasses really your values, your beliefs, your attitudes, your behaviors, and it's actually not easy to change your culture. So it's what I value, what I think is important in my life, what I believe to be true, maybe my religious beliefs, but also my other ethical beliefs, my moral beliefs, my attitudes, so the way I feel about things and the way I enact my values and beliefs, and my behaviors, so what I actually do to live them. So things like a value could be that I value honesty. I think honesty is very important. I think trustworthiness is very important. My belief, so I can believe in, I'm a Christian, I believe in God, so this is a belief that I have, right? Attitudes could be my attitude towards people or places or things, and then my actions towards people, my behaviors as a result of my cultural values. So I believe that First Nations people are all lazy or just drug seeking when they come to the hospital, then I'm not going to be very nice to them when they come to the hospital, right? My behavior is going to be pretty negative towards them. So the way that I enact these things. And even though we might like to think that we are all good and capable of changing things, it's actually really hard to change our culture. So we grow up in a specific way, with specific people in a specific environment, and it's who we are, right? And so it's not easy for me to change those beliefs and values and attitudes. And if somebody says to me, listen, you shouldn't treat people like that, it's not right, it's not fair. Well, you can say that, but it's not easy for me to change my perspectives, right? Because it's part of my culture. So if I think about the belief, for example, that I've heard when I've gone to HMC, that all Egyptians just fake their pain, they're too dramatic, and they don't need pain medication too much because they're just dramatic people, right? Have you heard this? Yeah. Okay. So this is a belief, right, that people have, that Egyptians just fake their pain, they're too dramatic. So what kind of attitude do you think that makes us have towards these people?
Even though the patient is in pain, they will think that he's acting.
Exactly.
Yeah.
So it gives us a very negative, they're just acting. I'm not going to rush over to give them their pain medication. They're just Egyptian and faking it, right? Oh, they don't know what they're doing. Why are they screaming? They should stop screaming. They're not having that much pain. So this affects my behavior as a nurse, right? Maybe I'm slow to bring them their pain medication. Maybe I do something really bad and I push their call bell away from them so they can't ring very much anymore, right? So this affects our behavior. And is it right? No, right? Pain is what the patient says it is, regardless of their nationality, regardless of their gender. Pain is what the patient says it is. It's not fair, it's not right, but it's not something that's easily changeable because people have long-standing beliefs and values about it, right? So even though I'm telling you these words now, and I hope that you will treat all Egyptian patients fairly about their pain management, maybe if it's your strong-held belief or value, it's not easily changeable, right?